Annette, thank you so much for joining me. It's been a great pleasure. I've been following your work for ages. You brought kind of a breath of fresh air because we were the quacks, if that makes any sense. And I've seen the actual results of your work and I'm astonished. How you been?
Oh my God, thank you so much. Thank you so much for having me. I'm great. I know we were chatting a little bit. I know that you're in Greece. I'm envious, but it's beautiful here in Montreal. So I'm going to have to say I'm awesome.
Awesome. And I've heard that we might have the chance to see you in person in Europe.
Yes. We just confirmed some new dates, September 24th and 25th for a sports performance program 2022 in the UK. Details will be listed on our website and hopefully on the link that you post below this podcast.
Perfect. Can you tell me more about it? What's going to be entailed in that kind of sports performance seminar workshop?
Yeah, so as you know, our approach is slightly different in the sense that we teach trainers how to incorporate a brain-based approach into a biomechanical setting. And as we previously discussed, the main missing link in most rehab programs or even strength and performance programs is the role of the nervous system into that movement. The primitive brain is huge because everything starts with the primitive brain, and then it just helps us generate movement and think and focus and digest our food and whatnot. So what we're going to be teaching mainly, and this is going to be an add-on to what you're already presently doing. So it really is complementary to anyone. Identifying muscle imbalances, yes, that's great, but most importantly, fixing your posture through a really efficient, straightforward way that could be done in under 5 minutes from anywhere in the world, regardless of which context that you're in. Key strategies to help you prevent injury and be pain-free for yourself, for your clients. A lot of the people that come into our seminars do have issues themselves that they're looking to resolve. Then take this information and be able to apply it in your work is a win-win situation for all. And corrective postural protocols, postural corrections to basically improve strength and stability, because most of our audience is going to be into fitness. We're going to gear it towards fitness, but the approach that we're going to take is really going to be different from anything that's ever been taught out there in the past.
So it's actually something that the person that will join you, that workshop, like let's say Saturday, Sunday, Monday, he starts to apply everything that he straight away.
In the workshop, they're already applying it straight away with themselves and their family when the workshop ends. But from a business perspective and a work perspective, you'll be able to apply it as of Monday morning. Perfect.
Annette, for people that don't know you, Posturepro, and let's know more about you and about your company.
So yeah, basically we're pioneers in talking about, and when I say pioneers is because we were the first ones to talk about this in 2004, and I remember precisely because I kind of put that information on Google, brain and body and posture and movement and performance, and nothing really came up at the time. Now a lot of people are talking about the role of the nervous system in a rehab context. So what we do is we really focus to kind of incorporate the role of the brain in movement. So it's really highly efficient and highly effective because the nervous system controls absolutely everything. Not only does it control the way that you think, the way that you are today, your ability to listen to what you and I are saying right now, Rocco, on the podcast, all of that is governed by your nervous system. And what most people don't really realize is that there is an imbalance in the nervous system. So what we did is we came about and created a technique, a method that will allow absolutely anyone to be able to apply it in their practice. But for myself, Posturepro really represents 2 or 3 different entities. Number one, we take clients in our clinic. Number two, because the results are so phenomenal, we said, hey, we got to start changing the world and helping people. So the best way to do that is to teach it to other healthcare professionals. So we have an educational branch, and we also sell different products online to help you achieve those goals, whether it be posture correction, children's primitive reflexes, foot posture, jaw development and whatnot, or anything really that revolves around the realm of what you can do to your body to improve that brain-body connection.
And how did that come, how did that idea come up? Like, how,
wow.
what made you to get to that?
Yeah, well, to make a long story short, I come from a family of neurosurgeons from my father's side. And I'll always remember when I was younger, my uncle would always say to me, and at the time, obviously, that made no sense for me, that the brain controls all. And I went ahead, I have a background in rehab, and went ahead and graduated there to be able to, take this back clinically into my practice. And very, very quickly, early on, right at the beginning of my career, I realized I was actually confronted with a question that absolutely tumbled my entire world upside down, which was, how many sessions will I need to resolve my shoulder pain?
Okay.
So yeah, that was a question that that basically destroyed my, I should say, my beliefs, because I was stunned. One, I didn't know what to answer. Two, I was doing what I was taught in school, and I was creating, alleviating the pain, but the client had to come back over and over again. So basically, in other words, it was a maintenance of the pain, and I was being paid for this and for my knowledge, and here I was not being able to answer a simple question, a relatively simple question. So took that question back to my teacher. My teacher said, don't know, don't care, just treat the joint and analyze it. Literally, don't know, don't care. Treat the joint and analyze it as you were learned in school, and you should be good to go. And, this is the personality that I have. This is not something that resonated with me. I'm like, how can I possibly have a good business ethics and practice if I'm not able to, one, fix a problem, and two, give a general timeline of how long and how many treatments will be needed to fix the problem. So I decided to gear my entire practice on fixing the cause instead of managing symptom. And that sentence has kind of become, we kind of built around that, but that is the message that we're constantly relaying out there. Now, the challenge was for me to explain how different we were, because not a lot of people are looking for neurology for shoulder pain or back pain. Hence the idea of teaching those courses online and in person to help trainers and anyone that's really in the realm of health and fitness, so that they can start incorporating that science into what they're already doing, because it starts with awareness, and awareness starts with education. So the moment that you tell somebody and explain to them in layman's terms that their brain is at the cause of their injury, of course, we're going to exclude a traumatic injury from this equation. But people start to understand, and people are not dumb. When you explain it to them, they're like, wow, that makes a lot of sense. And what's amazing is when you're working on a nervous system that is healthy, the results are, I want to say they're at the speed of light. They're at the speed of the nervous system, which is how long does it take for you to feel when something touches your skin? That's how quickly those changes are happening. So I found that to be revolutionary in itself back then. I still do today, because still no one is really incorporating all of the protocols that we teach and we do. And hence the idea of teaming up with you and spreading that awareness and spreading that knowledge and that science, and helping people have just a more balanced, injury-free wellness type of life, so that they can get back to doing what they love to do.
Incredible. Incredible. And yeah, I'm keeping the word you said, balanced. What's actually causing those imbalances? Because nowadays it's like, take it from posture, take it from the nervous system, take it out the CNS is like, with PNS, CNS, like always are on the go. Everything is just go, 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 go. And what's the case? What's causing those main imbalances from what you've seen the past years?
In a nutshell, and to keep it simple, it's an imbalance in the nervous system. It's an imbalance in the way that that specific human, I'm going to refer to the person as a human, because we begin at birth, and when we start to move, that specific human did not properly learn the different neurological stages that were needed in order to build the layer above the stage below. So what I mean by that is in our nervous system is separated, so we can simplify it in different segments, lower part of the brain, the medulla, the pons, the midbrain, and the cortex. And all of that information, all of that specific part of the brain is very, very important for us to learn how to move. Obviously, there's a whole bunch of other functions that are governed in that brainstem, which we're not going to get into this podcast. But when these certain stages are skipped, For example, an example of this would be encouraging an 8-month or 9-month-old to walk in an upright posture at 9 months. That would be skipping stages of neurological organization.
And people are happy
can,
sometimes when their kids are walking and they skipped crawling, right?
Well, yes, most tend to think that the child is highly intelligent.
Yeah.
And I'm not saying that they're not, but it is going to create a problem later on in life because that's crawling. Those stages between 9 months and 12 months, if we're using that example, are absolutely mandatory to connect both parts of the brain together. So the part of the brain that's responsible for doing that is the corpus callus, and the corpus callus gives us that connection between the right side of our brain and the left side of our brain, which is essential in gait, in upright posture, in walking, and in being balanced. So if we're not well balanced from the right side of our body to the left side, to the front, to the back, what ends up happening is that we start creating those movements, faulty movements. I call them faulty movement patterns, which eventually wear down our joints, which eventually cause pain, and which can, of course, lead to injury. But all of these things are symptoms, the cause being, in this example, the human did not crawl or started walking at the age of 9 months old, and it was not able to crawl between the age of 9 months to 12 months in this example. So we want to take it back to the cause, the root cause, fix it, because you can actually fix it at any point in time. Even if you're 50, 60, 100 years old, as long as you are alive, if you give proper information to your nervous system, you can actually fix it or reverse it up to a certain degree. Obviously, there's exceptions. If there's Parkinson's disease, if there's medication and whatnot, there's different things that will prevent that from happening optimally. But if we're talking about someone that has a healthy nervous system, the results are usually very quick. Hence, no longer having that need to have all of those different consultations. Right? Going back to how many consultations will you need? Most of the people that come and see me in clinic, I'm their last resort. They've seen everyone.
Literally everyone, yeah.
They've spent that much money, never mind the money, they've spent all this time, right? The only thing you can't buy is time. Exactly. And they still have pain. So I'm usually the last call, the last resort where people come and see me to resolve the issues that they're having. So, yeah, so in conclusion, in a nutshell, making sure that we, where does this come from? Well, it comes from parents not being aware, young parents, women giving birth, and I'm not suggesting that we should not have epidurals or cesareans or whatnot, but women giving birth, taking epidurals, scheduling cesareans, planning their births, the lack of breastfeeding, shoes on our kids at a very, very young age, preventing movement, and the list goes on and on and on.
And then regarding that, what you said, it's a good segue. It wasn't a question I would ask, but it just came up. I've been following a lot of the malocclusion part of breathing, and it's an epidemic. There are a few books out. Jaws, for example, was a really good book, exactly saying that, you know, when kids, infants are not breastfeeding enough, and the author said, look around you, that everybody's staying with their mouth open, everybody's a mouth breather, and all the complications of that. How can we fix that? Well, again, education. Children need to breastfeed ideally up to 3 years of age. Again, I'm not suggesting that women do this. If we're talking about the most optimal scenario for human development, there needs to be breastfeeding at least a minimum of 1 year. Now, I'll have some women say to me, well, I was not able to produce enough milk, the latching on really hurts me. Obviously, if you can't find a way, you need to consult with someone and make sure that you feed your baby. But under normal circumstances, a child should be able to breastfeed. Now, one of the things that we're seeing a lot is a lack of muscle tone. When a baby is born, they can't even latch on. And the lack of the ability to latch on is an expression of a lack of muscle tone. So this is actually those postural imbalances, if I can just open a bracket for a second here, are actually being, how can I say,
go from generation to generation to generation. So you can actually transmit postural imbalances, and there's a study that actually confirms that, up to 3 decades. So the sooner we correct ourselves, the better we'll be. But this entire ability to be able to breastfeed is actually essential, super important for tongue posture, for the development of all of the muscles that will assist us later on for speaking. And while all of this is actually happening and developing, what ends up happening is that we're stimulating a very specific area in the brain that's helping us myelinate our vagus tone. Again, I'm talking about us being babies at that point, breastfeeding, and the development of the vagal tone is something that goes hand in hand with primitive reflexes, which allows us to inhibit primitive reflexes. What is a primitive reflex? It's basically a movement that you're unable to control voluntarily. The control, or I should say the inhibition of that reflex, comes directly from the brain, specifically the frontal lobe. So when we grow up and become fully mature, 8 years old, usually at 8 years old, the frontal lobe is able to inhibit that primitive brain, that reflex that wants to come out. And all of that happens or begins, believe it or not, with breastfeeding, with mouth work, and with movement.
What if we, thank you for that, that was great information, because we forget that the primitive reflexes that we take for granted, they need to clear up to specific reflexes, primitive reflex, need to clear up to certain ages and need to be actually worked on, because we see that on babies sometimes when we try to motor reflex or try and figure out things. If those don't clear, let's say they're not, we don't exercise them, or we don't go through them, or we don't clear them, and people follow them through, what can be the problems that patient, that person can
My
have?
God, I mean, the list goes on and on and on. I mean, if you just, it's endless from everything and anything that involves understanding, writing, speaking, controlling emotions, gross motor skills, fine motor skills, movement, the use of your hands, sports performance, posture, autism, ADD, ADHD, mouth breathing, facial developments, mouth development, teeth eruptions, foot posture, slouched posture. I mean, it doesn't end. So everything is connected to primitive reflexes, and every single, there are specific reflexes. If we go back to the beginning of our podcast, of this podcast that we're doing, those different, in the lower part of the brainstem, in the medulla, you have very basic movements like the grasping reflex and the sucking reflex and whatnot. And then when you go one layer higher in the pons, then you have more sophisticated reflexes that now start to involve the movement of the head and the upper body and so on and so forth, until the baby is able to crawl, hence the crawling, right side of the brain, left side of the brain connecting together. So again, in a nutshell, if some of those reflexes are still active today, which, by the way, if there's a postural imbalance, chances are there are primitive reflexes that are still active. Almost 100% of the time, it's very hard to have a postural imbalance if you don't have primitive reflexes that are still active. And they can also have a direct impact on your ability to digest and ingest food. So very often, more often than not, we'll see that there's also issues with digestion. So if you actually take in all of this, how can I say, all of this information and propel it and project it into what we're seeing in today's world, all of the different therapies that we've created to try to manage those symptoms can, in essence, all be linked back to the way that we learned how to move, hence your primitive brain, hence primitive reflexes. Now, where this becomes really interesting in our courses is when somebody comes into the office, unless you work with kids. I do work with kids, but I also work with athletes and adults and whatnot, and I'm sure our listeners do as well. Where this becomes a problem is when somebody comes into your office and has been overcompensating lower shoulder, lower hip rotation, slouched posture for a year. Sure, working on the primitive reflex is going to help. But if there's an imbalance with the feet, if there's an imbalance with the eyes, if there's a problem with the jaw, you have to address those components first, because that specific individual has been overcompensating and their fascial system now is in a state of compensation that is not going to be able to be reversed quickly enough through just primitive reflexes integration. So the quickest way with an adult is to address the sensory receptors. I don't know if we'll talk about that later, the feet, the eyes, the jaw together for a certain period of time, and then work on primitive reflexes. And what we found, because I work with a lot of functional neurology doctors, is that when you actually correct posture first, you inhibit some primitive reflexes naturally, meaning you help the brain integrate them, suppress them naturally just by working on posture. So as a trainer, this is extremely important, or even as a therapist, because this knowledge is extremely important to know, because you want to be working on primary reflexes that are really, really stuck, that you're not able to integrate. And you want to, I call them working on primary subluxations of the nervous system, because then for example, let's say you have 5 primitive reflexes that are still active and you correct posture and now you end up with 2, then these are the 2 that really need to be worked on. But if you don't know anything about posture, feet, eyes, jaw, and you're working on 5, then what that translates to for your clients or your patients is a lot of sessions, a lot of time wasted for you as a therapist, because you should be focusing on these 2 as opposed to working on the other 3 that are actually just how can I say, a compensation of a poor posture. Does that make sense?
It does. And my next question would be, should parents that have kids like in an early age, let's say 3, 4, 5 months, need to find a practitioner at your stature, or people that actually follow your method to actually have a better outcome through their years growing up? Because
yes,
it needs to be something that needs to be addressed at an early age.
Yeah, and as you said, no parents are aware of this. This is it's absolutely it's stunning to me that no one is aware of this. And the reason that they're not is because the doctors are not, obviously it goes back to doctors, they're not relaying this information to the parents. Primitive reflexes are usually things that obstetricians are concerned with when it comes to cerebral palsy or issues with the nervous system. So they kind of do this really, really quick test. And once it clears, they don't really look at it afterwards. But we know there's solid groundwork in neuroscience that does confirm it is a problem. It is a milestone that kids have to go through at the early stages of life, and parents must be absolutely informed. So what COVID allowed us to do was to create a really quick online certification. If you're looking for really quick ways, 10 tests to do and how to integrate them, then we have reflex and brain development. But we do cover these topics in full detail with what we teach, which is the Posturepro method, where we begin from the beginning to end, and we talk about the full neurological organization. And really our program, you can't have a more complete program when it comes to incorporating or understanding, because that's what's going to make the therapist be different than other therapists out there, is the understanding of how that nervous system is affecting absolutely everything that we see in clinic. And that's where everyone gets that additional knowledge, where you're going to be able to set yourself apart from the competition out there. And what I mean by that is be able to offer something that's different, that hasn't been done before.
It works.
And we know that in Europe and Greece, actually Europe is a little bit more sensitive to primitive reflexes than North America, in all fairness. But in the UK and Europe, there's really not a lot of practitioners that are actually applying the Posturepro method to their concept. Hence the reason why you and I are here today.
Yeah, for sure. And 24th.
Let's change that.
Amen. Regarding the role of what we're saying about, because the topic started with kids. When should children start wearing shoes? Is it too early to get them wearing like barefoot, or
3 years old?
3 years old.
Kids should start at 3 years old. This is when they start to form. I mean, if you look at the X-rays of a foot of a kid, they barely have any bones that are already fused there. Exactly. And at 3 months old, we start to shrink that. So the shape of the bone and the connections to the bone and the muscles and the ligaments, all of that is going to follow that shoe that is put on the foot. So the challenge in North America, I'm going to say in the United States, is that mothers can only breastfeed up to 3 months. I know that in Canada it's 12 months. I think in Europe it's more lenient. I don't know every laws in every single country, but that is a challenge, because if you're a working parent, how are you going to manage this? And there's different, coping mechanisms that we can try to come up with. I like to buy these really flexible shoes, and they do. And then I used to order them from Europe, and they are very costly. They're like €100 or something a pair. That was pre-COVID. Post-COVID, I have no idea. But essentially, as a rule of thumb, you want to take a shoe that's super flexible, that you can actually twist like a sponge if you have no choice. And then when your child is home, let them walk and move and move and move as much as they want. So every single thing that you can't stand, like grabbing a pen and just having them, they're hitting down, and it's just driving you insane. Every single thing that they do, you need to let them do it as much as possible, because that's basically them synchronizing the hand with the sound, with the movement, with their arm, with their body. And every single thing has a very, is purposeful at that age.
Can that, going back to the integration of the reflexes, will help with movement, like because kids nowadays are inactive? Does that actually inhibit their proper foot movement?
Their foot movement?
Yes, regarding that, yeah.
Of course. I mean, keep in mind that a child cannot stabilize themselves fully like an adult up to the age of 8 years old. The stabilization of a child happens at 8, when the frontal lobe is mature, when the head, on the shoulders, on the pelvis, and on the feet can be synchronized together. Now, where you're going to see an imbalance with primitive reflexes is when a child is unable to separate head movement from upper body movement. So for example, if I said to you, stand up straight, put your feet together, put your arms like this, and just turn your head to one side. And if you see the whole body turning with the head, then that would be, that could be indicative that there's a primitive reflex that's still active. Same goes with upper body. Keep your head steady, keep the lower body steady, and just turn the upper body. Is your pelvis shifting with your torso? If it is, that could be indicative of a certain primitive reflex. But with kids, it's really simple. If they're 3 years old, 4 years old, 5 years old, at 8 years old, a child should be able to stabilize their body on one foot for 30 seconds. Just stand on one foot, lift one foot off, and see what happens. Is your child looking like this? Are they like completely falling off and they're 7? Then that would be indicative that they have an immature nervous system. Again, I'm not saying that there's anything wrong with your child. I'm just saying that we can do stuff to help them integrate and optimize their nervous system, which at the end of the day is going to help them with absolutely everything. But first and foremost, their tolerance to stress, their ability to manage social engagement systems out there, and to be able to control their emotions. And that's huge, because you know how much we're talking about stress and parasympathetic stress and whatnot. Well, if a child is unable to feel their body, they're not going to be able to feel emotions. And if they can't feel emotions, they're going to be pulling tantrums.
Yeah, we don't want them.
And yeah, and I don't know about you, but you don't, as a parent, I don't know very many parents that are going to want to live in a state of constant tantrums 24/7. You'll kill yourself, right? It's just, it's really suicide. So everybody benefits from it. And the way that, you know, there's certain things to look for. Again, we teach it in our courses. There's certain things to look for, but these same things apply to adults. So with an adult that has high anxiety, for example, or has a postural imbalance, there's very specific landmarks that you can look for. And once you address it, you actually have an effect on their posture, yes, on their brain, yes, but because the brain and the brainstem is connected to your vagal tone that goes all the way down to your digestion, well, your hormones are going to be affected, your digestive enzymes are going to be affected, your cortisol, your ability to manage your cortisol, your blood sugar, your pH balance, your blood flow to your stomach, your enzymes, and so on and so forth. So it basically affects absolutely everything. So I wish we could say that, oh, we're just going to fix that shoulder pain. We're actually going to end up targeting every aspect of the human body, because that's the way that the nervous system functions.
Thank you for that, because we live now in an era that, you know, people are calling us like the posture police, when we are actually giving when everything's about posture in so many ways. And also from an assessment part, like a person, a patient walks in and just looking at him, you can see so many things and give a proper assessment by that. But now we're kind of scared of telling them, that posture plays a massive role in so many ways.
Well, Yeah, I just want to add something to that. I like that you said we're scared. You know where I find that trainers, if we're going to use the word scared, is that some feel challenged by the fact that they think, I think that they want to explain the neurology, the complicated neurology in the context of their therapy. What we've done is we've actually oversimplified this for you. Yes, everybody's talking about posture, but what people need to realize is that posture is a symptom. It's a symptom of your brain. So the posture that you have today is the result of how your brain is projecting onto your muscles. And once trainers, healthcare practitioners, parents, or even doctors, and just the general population understands that it begins with the brain, then we have to start developing therapies that are geared towards a brain-based approach if we want to treat the cause. But treating the cause is not very beneficial for some from a financial aspect, because it does reduce, it really does reduce your
chain.
Right. And we are in that era where what are we doing really? But what it does is that you are no longer need to see that specific individual for 30, 40, 50 sessions. You don't. You're going to clear everything under 6 sessions. Again, speaking about a healthy individual, if you're doing it right. But at the same time, the upflip of that is that you'll have so many referrals that you're not going to know what to do with your time. But most importantly, I find that what's much more motivating is you're going to be changing lives. And that gives goosebumps, because you're going to be changing the life of a child or an adult. And quite frankly, I think that if people are in less pain, I think we're all going to be, we're creating a new world where people will be kinder to one another.
100%, and especially now living in a pain epidemic with no one actually says what's going on with the opioids and all the kind of too much pills just to cover the symptoms, right?
Correct.
Now to go back to training, because I know that it's going to be sports performance on the workshop, and I always talk about the big toe and proper movement, and why is it so important to the rest of the body's biomechanics? What's your opinion? What's your case? What are your thoughts?
Well, the big toe gives us an indication in regards to gait, and gait movement, which does happen with the big toe. I mean, you need the big toe for the propulsion, for the takeoff. And again, I'll try to keep this simple, but it gives us a great perspective into someone's nervous system again. But in order for the big toe to be able to flex properly and then propulse your entire body weight forward while your other leg just swings forward, you need to have integrated, and it's going to go back again to reflexes, what is called a Babinski reflex. Mm-hmm. And a Babinski reflex is basically when you take a piece of, if you use a pen, for example, and you stroke the skin of the foot, in an adult, the toe should go into flexion. So the brain is able in an adult to inhibit the extension, which is what we would see in a child under the age of 12 months old, and hence produce that flexion movement that is needed in order to walk. So there's that component. Now, if you have proper toe flexion and proper foot mechanics, what ends up happening, again, in a perfect world, is that you have formed a proper arch in the 3-dimensional spaces, which means that when I look at your foot, there is space, your midfoot is not collapsed on the floor, and it's not too much externally rotated, so there's a proper arch. If you have this entire symphony of things working together, then when you are walking, you are able to propulse your body weight forward, and you're able to swing your arms in the opposite way. All of that, all of those different the mechanics of walking, if you want, are directly linked to the right brain and the left brain, because when you think about it, you have to have orchestrate a very complicated system to be able to inhibit and activate muscles contralaterally and front and back simultaneously without you having to even think about it. So if you have movement patterns, primitive reflexes that are constantly active, if you don't have a poor toe extension or flexion, if you have a flat foot, then that's going to affect the mechanics of your lower body. And that, again, is going to affect the mechanics of your ankle, which will affect the mechanics of your knee, your hip, and will ultimately affect the curves of your spine. So one of the things that we do in our courses is we look at somebody from the side. Static posture, stand normal, stand, and let me look at you from the side. What's going on? And then you can see, this is where you see the reflection of that muscle tone. Are they projected forward? Are they projected backwards? Do they have a forward head posture? Do they have slouched shoulders? All of that, when you start to integrate all of these things together and you have that knowledge and that science, looking at someone's posture from the side or even through their gait gives you so much information. You know exactly where to begin and what to do. So I'd say that the big toe is extremely important, but it does begin again in the early stages of life, and making sure that we can improve big toe development and gait, and developing our foot posture and our arches as optimally as possible.
Can we get our archers back, or do we need like help with, you know, insole or other kind of tools? Do you think that like a collapsed arch can, with proper training, with all the functional neurology things, can we get our arch back?
Yeah, so that was the $1 million question for me, because I was working. What I always show a picture in my seminars, which shows the back of the feet of someone, which basically, if you take your iPhone and put it on the floor and you stand in front of it and take a picture of your Achilles tendon, what you'll notice more often than not is that you have one foot that is more collapsed in and the other one that is outward, so pronation, supination. And for years, I mean, I worked on just, you know, manually working on the foot and stretching that muscle and pulling it and activating it and testing it and whatnot. But when the person got up on their feet and I took the same iPhone, put it down, took the same picture, superimposed the images, nothing changed from a structural perspective, but they felt better. Okay, that's because the nervous system, they will feel better because you worked on the muscles and you stretched it. So in other words, you touch the muscles, you stretch it, that sensory information goes into the brain releases the muscle. A couple of steps down the road, the pain will always come back. So what's available to us in the 21st century? Who are the feet specialists in the 21st century? Podiatrists, right?
Yeah, chiropody or podiatrists, yeah.
Right. So what do? What's the solution that they have? Well, the solution that they have is to mechanically use an insole, we're going to call it an insole, and mechanically support your arch. So that's great when you've had a severe injury, or if you're in a massive state of inflammation. That's wonderful in that moment to allow your body to heal so that we can mechanically position your ankle in a proper posture, because they know that the ankle affects the knee and the hip and whatnot. So they're mechanically moving your foot in that posture. But the problem is people end up wearing them for years.
They're adding a problem to the problem.
Well, and they don't realize it. And exactly. The people that are buying those orthotics don't realize it either, because one, they're refunded, so they're happy with that, right? So they don't have to pay anything, and they think it goes under healthcare, but they're not realizing that what they end up doing, compare the mechanical support to wearing a cast. Yeah. So if you wear a cast on your arm and you prevent your arm from moving and your muscles from working out, your biceps and shoulder, you atrophy. Well, the same concept applies in the foot. And this is where people start to get really confused, because you're kind of like clashing with their reality, and they're like, oh, hold on, what's going on? And they kind of realize that they've been duped all this time. It's not that you've been duped, it's that your doctor told you what to do this, and you went ahead and did it without questioning it, and that's fine. But so what we did is we looked into science. We said, okay, well, what's the foot composed of? 3 things: skin, bones, muscles, and fascia. Okay, we said, great, the whole body is composed of that. That's wonderful. The foot is no exception. So then we said, oh, let's take a look at the foot in the sensory strip of the brain. Does it have a lot of room? It turns out the mouth and the hand, as you know, allocates a lot of room to the sensory cortex, right? And the foot is also there. So we said, sweet. So in the skin, are there sensory receptors? So if you Google mechanoreceptors in your skin, there's tons of them. Why are they important? Well, if I burn myself, I need to remove my hand, right? And if there's a mosquito that's pricking my skin, I need to feel it. And if something's crawling on my hand, right? So those mechanoreceptors are sending that feedback to my nervous system constantly to inform me of whether I need to run or hit the mosquito, or am I stepping on a glass, what's going on. So all of that information is being processed at the speed of light, at speed of the nervous system, I should say. So we wanted to know if we can use this to our advantage by using those mechanoreceptors in the skin of the foot. And it turns out that when you use an arch support that is more than 3 millimeters in height, you actually atrophy. So basically those mechanoreceptors send a signal to your brain, hey, there's pressure, 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 and then the signal goes
That's
dead.
it.
Right? So what you're doing is you're really inhibiting that sensation, that message that's going into the brain. But if you go below 3 millimeters, what you do is you activate it.
Incredible.
So we said, sweet. How can we make this fit in a shoe? Should we develop a shoe? Should we make a shoe, like a new Nike shoe? That was not possible from a financial perspective. So we said, let us, right? And the competition out there, never mind. So we'd go bankrupt before anything. So we said, let's create a thin, really flexible insert. And let's use wedge in specific parts of the foot, because your heel versus the side of your foot versus your big toe to your Twinkie versus your metatarsal or midfoot, all of that creates a different postural response in your body. Mm-hmm. So when your ankle lands on the floor and goes on the side and then 5, 4, 3, 2, 1, take off with the big toe, you have different mechanoreceptors that are activating different muscle chains. Yeah. So when you use this knowledge to, with wedge height, under 3 millimeters to activate those mechanoreceptors, you can actually create postural changes. The person, in essence, is able to activate muscles unconsciously. So activate their back muscles and pull themselves back, bring their shoulders back and whatnot. And you can do this through using wedge. And so what we did, we said, well, let's create an insole wedge, and we use the frequency, same principle with the frequency. And what we created were different products that people can buy depending on their postural issues.
Thank you, because I've been in the sports industry like 2 decades now, and I hate insoles, because I always explain that when your foot needs to go, like when you step, you need to open up. When you have load, you need to have the arch. But all the time, you can see those massive arches in there, and I'm like, yeah, biomechanically, this is abnormal. Like, you're creating more problems to actually, save yourself. And sometimes, it's all about mass media and the production of money. And I had numerous, especially tennis players in the past, the first thing I had is a pair of scissors and just cutting all the stuff they had in, and miraculously the pain went away.
You and me both. You and me both. I think it takes I think that you and I think alike, and people are kind of shocked when you're doing that, and they don't realize, but that's the problem. In all running shoes, they permit themselves to put an arch support without even asking for your permission.
Exactly.
And that arch support, although it might seem really harmless and small, is actually creating changes at the level of your gait that you're not even aware of.
Where can we find those soles, and how we can, like, people are going to come to your seminars will know how to use them on their patients, and when and how and what?
Yeah, so the soles are sold on shop.posturepro.co for the United States, and EU as in Europe, eu.posturepro.co for Europe. And it is an important part of our seminars, and it is an important part of my sessions. All of the results that we have been obtaining clinically for the last 16 years have been solely with the therapeutic insoles. As a matter of fact, we just did a study with the Massachusetts state with police officers, where we demonstrated that through foot correction with the therapeutic insoles, we can have an effect on their posture, their sagittal plane. Remember, when, as I was explaining, the sagittal plane shows you how well the person is accepting the forces of gravity, which is a direct expression of that primitive brain. And also, we were able to improve their grip strength and to improve their blood pressure and shooting accuracy. So we tested 13 officers. I put the video on my YouTube channel, which is at Posturepro for those of you that would like to go through the breakdown of the graph. But we tested 13 officers, and there was a positive response in all 13, and some of them are on blood pressure medication. So even with that, we were able to reduce their blood pressure. And this